Triangles of neck. See digastric triangle and carotid triangle in next video. Anterior triangle boundaries. The boundaries of the anterior triangle of neck are the anterior median plane of the neck medially, a line joining the angle of the mandible to the mastoid subdivisions. The anterior triangle is subdivided by the digastric muscle and the superior belly of the omohyoid into d. Muscular triangles, figure 4.10. Sternocleidomastoid laterally, base of the mandible and process superiorly, figure 4.10. A. Submental, B. Digastric, C. Carotid, and this is a median triangle. It is bounded as follows. On each side, there is the anterior belly of the body of the hyoid bone. Its apex lies at the chin. The floor of the triangle is formed by the right and left contents. 1, 2 to 4 small submental lymph nodes are situated in the superficial fascia between the anterior bellies. A. Superficial tissues below the chin. B. Central part of the lower lip. C. The adjoining gums. D. Anterior part of the floor of the mouth. E. The tip of the tongue. 2 small submental veins join to form the anterior jugular veins. Submental triangle corresponding digastric muscles. Its base is formed by mylohyoid muscles and the median raphe uniting them, figure 4.3. Of the digastric muscles, figure 4.3. They drain. Their efferents pass to the submandibular nodes. Contents anterior part of the triangle. 1 superficial part of the submandibular salivary gland are superficial to it and the facial artery is deep to it. 5 the hypoglossal nerve region. Structures superficial to mylohyoid are, figure 4.3. 2 the facial vein and the submandibular lymph nodes. 3 submental artery. 4 mylohyoid nerve and vessels, figure 4.4. Other relations will be studied in the submandibular. Posterior part of the triangle. 1 superficial structures are, A. Lower part of the parotid gland. B. The external carotid artery before it enters the 2 deep structures, passing between the external and D. The pharyngeal branch of the vagus nerve. E. F. A part of the parotid gland. 3 deepest structures include, A. B. The internal jugular vein. Most of these structures will be studied later. Parotid gland. Internal carotid arteries are, A. The styloglossus. B. The stylopharyngeus. C. The glossopharyngeal nerve, figure 4.13. The styloid process. The internal carotid artery, figure 4.13. C. The vagus nerve, see figure 3.8b. Muscular triangle boundaries. Hyoid bone to the sternum. Anteriorly. Anterior median line of the neck from the contents. The infrahyoid muscles are the chief contents of the triangle. These muscles may also be regarded arbitrarily as forming the floor of the triangle, figure 4.6. A. These ribbon muscles have the following general features. A. They are arranged in 2 layers superficial. B. All of them are supplied by the ventral rami of first, second and third cervical spinal nerves. C. Because of their attachment to the hyoid bone and to the thyroid cartilage, they move these structures. E. The anterior surface of isthmus of thyroid gland is covered by right and left sternothyroid and in table 4.1. This is a thin nerve loop that lies embedded in the anterior wall of the carotid sheath. Over the lower part of formation it is formed by a superior and an inferior root. The superior root is the continuation of the descending. The infrahyoid muscles are, sternohyoid. B. Sternothyroid. C. Thyrohyoid. D. Omohyoid, sternohyoid and omohyoid, and deep, sternothyroid and thyrohyoid, figure 4.6. D. Sternohyoid, superior belly of omohyoid, and sternothyroid lie superficial to the lateral or superficial convex surface of the thyroid gland, see figure 8.4. Sternohyoid muscles, see figure 3.3. The specific details of infrahyoid muscles are shown. Larynx. It supplies the infrahyoid muscles, figure 4.15. Ansa cervicalis or ansa hypoglossi. From the first cervical nerve. This root descends over the internal carotid artery and the common carotid artery. The inferior root or descending cervical nerve is derived from second and third cervical spinal nerves. As this root descends, it winds around the internal. The superior root in front of the common carotid artery distribution supplied by separate branches from the first cervical branch of the hypoglossal nerve. Its fibers are derived jugular vein, and then continues anteroinferiorly to join, figure 4.15. Superior root, to the superior belly of the omohyoid. Ansa cervicalis, to the sternohyoid, the sternothyroid. Inferior root, to the inferior belly of the omohyoid. Note that the thyrohyoid and geniohyoid are nerved through the hypoglossal nerve.